We've made a cut here. Now I'm going to make a cut at an angle.
There has been no discomfort from the actual surgery.
I walked out of the hospital. My husband was shocked.
So the compression of the screw has literally put the bone back together again, and it's nice and solid.
Recovery has been exceptional.
It's the best thing I've done for myself.
Over the coming years, this is going to be the bunion procedure of choice.
Hello, I'm Joseph Benty. 72 million people a year face surgery, and in our fast-paced world of new technology and changing healthcare, it's difficult to stay abreast of the newest procedures and the doctors who best perform these procedures. Thanks to the tri-correctional bunionectomy procedure, there's hope now for the many people who suffer from bunions. These are the symptoms that are often caused by bunions. Calluses on the inside of the big toe, pain around the big toe when wearing certain shoes, difficulty wearing shoes, painful calluses on the bottom of your feet, and the big toe pushing on the second toe. There's probably no other human malady that is so common, yet so misunderstood, as bunions. Correspondent Abby Bunnell helps to clear up the misconception.
Thank you, Joseph. You may find it surprising, but 1 out of 6 Americans have bunions. And contrary to common belief, they're not something that affects only the elderly. They're a painful, primarily genetic problem that can strike at any age. Traditional bunionectomies have often required a lengthy recovery, minimal walking and being inactive for months. But that has all changed due to the tri-correctional bunionectomy, which employs surgical engineering and has had impressive results. This technique was pioneered by Southern California-based MedStar Foot and Ankle Center.
MedStar uses state-of-the-art diagnostic technology found in the most advanced laboratories in the country. Unfortunately, most doctors lack the technology to measure what happens when the body moves. And this is important in repairing dynamic, moving parts of the body, such as toes and ankles. Dr. Alan Selner, director of MedStar, is the man who developed the incredible bunionectomy featured on today's program. We're going to follow the tri-correctional process step by step as Martha Contreras is treated by Dr. Selner.
Bunions are pretty complicated, and most of the time people don't put much credence into how complicated a bunion really is.
When Martha came to see me, she is just an adorable person. She's very frightened, and I can see the fear in their eyes, and I sense it because I was hurt when I was a child, and I'll never forget the fear I had going to see doctors, and I didn't want my patients to feel that way. And when I first talked to Martha, she'd hold back a little bit because she was afraid. But after she began to talk, she began to open up about some of the problems, and she's had a lot of pain, and she was very concerned because her toe is getting very crooked, and where was this all going to lead? When you really understand the mechanics of the way people walk, you realize how important the big toe really is. In fact, all toes are important, but the big toe is the most important. And it's simple enough. If you stand up and lean forward, if your big toe doesn't work, you'll fall flat on your face. If your big toe doesn't bend correctly, if it doesn't support you correctly, you can get back pain and knee pain all from a big toe not working. And when the big toe doesn't work, it creates secondary problems. The toe gets crooked, it slides over, it bangs into the toe next to it, that gets raised, and you end up with 5 or 6 problems that all could have been avoided.
Even though 1 out of 6 people suffer from bunions, there's still a lot of confusion as to what a bunion is. How do you get them? How are they treated?
Excuse me, sir, do you know what a bunion is?
Yes.
Have you got one?
Not anymore.
How is it treated?
I removed it with a pumice stone.
It's a growth on your foot, usually on the heel.
A bunion is a growth like a blister, only it's a solid growth on the foot.
It's a bone that you need to have a couple of surgeries to have removed.
It's the guy with the big blue ox, right?
While most people's concept of bunions may be humorous, it's really no laughing matter. Let's have Dr. Selner put the problem into perspective for us.
Actually, what it is a crooked joint. The big toe is crooked, and you develop an arthritic bump at the big toe joint. Well, that arthritic bump rubs all the time, and it develops a red swollen area called the bursal sac over the top. That's what hurts.
But boy, I get these real bad pains, and so I thought, well, it must be the shoes. So I started buying very expensive shoes.
You know one thing absolutely about bunions: they get worse.
But the pain kept getting worse. In the middle of the night, I'd wake up and it'd feel like somebody was driving a nail into the knuckle of my foot. It just wake you up. They grow so slowly you don't notice them. But I got to realizing it was beginning to look like a bunion.
People will never believe me when I say I've seen 6-year-olds with bunions. But you know what the problem is? They don't recognize it as such. If you talk to most people who have crooked toes, they'll tell you, I've had this all my life. It's normal because it comes on gradually. We have had to do many surgeries on 12-year-olds, and I don't believe in doing surgery on anybody unless they need it.
I'm really glad I had it because my feet are so good. They look really good now. So.
If you look at fathers and sons, mothers and daughters, this runs in families.
My mother had them so badly that her big toe totally crossed over all the other toes.
It may skip a generation, but it does run in families.
She gave us the ugliest feet.
If a toe is crooked, if a toe is hitting your second toe, if a toe has callus on the side, if a toe doesn't bend very well, those are all signs that you're probably developing a bunion. Get to it before it becomes a severe problem.
I had heard so many horror stories about bunion surgery, I was a bit reluctant to go ahead with it.
So naturally I was apprehensive, and that's why I put it off for years and years and years until I got married. And what I used to do is crack my toes to relieve the pressure, and it was driving my husband nuts.
If I sat down, I didn't get back up very well. So I would eat standing up or lean against a vehicle when you're talking to the guys. Sitting down was a luxury because you'd have so much pain when you get back up, you might as well just get that pain level going and stay with it. And you do some drastic things. Then getting home, you take it off, and it got to be so bad that even putting the comforter over your foot would hurt.
Before coming to MedStar, many patients had fears about bunion surgery.
And when I went to see the doctor, he said, sure, I had bunions, and I was going to have the traditional surgery. And he was going to cut up high and put pins in and shorten one of the bones. And so I wanted to have them both done at once because he said it was going to be 6 weeks to 6 months that I was going to be in a great deal of pain and recuperation. Well, I didn't want to go through that twice, so I wanted to have them done together, and he said no, that wasn't possible.
Being an ex-operating room nurse, I had scrubbed on quite a few bunions, and I had seen what they do. It truly is a bunionectomy, where they go in and they chop that big piece of bone that's sticking out, and I used to, this looks so traumatic. And I knew at that time I had bunions, and I wasn't about to have it done. I was like, no way, I think I'll just live with this.
Traditional bunion surgery really focused on one simple thing: take the bump off.
And I saw that what he does is they go back and they normalize your anatomy. They put everything back where it should be. They're not chopping off a big chunk of bone. And I went, okay, I'm going to go interview this doctor, and I'm going to see if he knows what he's doing. And that's exactly what I did. And I was totally thrilled with the way it was explained to me that it truly isn't as traumatic as what I had seen 20 years ago when I was in the OR.
We'll continue to follow Martha Contreras' treatment and find out from her and other MedStar patients how the tri-correctional bunionectomy worked for them. But first, let's learn more about Dr. Alan Selner and his staff at MedStar.